Welcome back to the Quantum Couch. I am your host, Dr. Ina Conboy. Have you ever had a gut feeling about something, a sense you couldn't quite explain, and later realized it was right? We often call that intuition. For centuries, it's been framed as mysterious or mystical, but modern science is starting to catch up. Research shows that what we experience as intuition may actually be our brain's way of rapidly processing information, drawing on past experiences, subtle cues, and even emotional memory, long before our conscious mind can catch up. Neuroscience has found that areas like the insula and amygdala play key roles in this rapid unconscious pattern recognition. Some psychologists even call intuition a form of fast thinking. But there's more. Studies also suggest that mindfulness and introspection, the awareness of our internal body signals, can strengthen intuitive accuracy. So intuition isn't just a hunch floating in space. It's tied to real, measurable processes in the brain and body. In today's episode of The Quantum Couch, we're going to dive into intuition from both angles, how it's been understood through human experience, and how science is uncovering the mechanisms behind it. We'll explore where gut feelings come from, why they can sometimes mislead us, and how tuning into intuition might be a skill we can actually cultivate. To help us unpack this, I'm joined by Dr. Katrina Garvey, a psychiatrist whose career has spanned inpatient, academic, correctional, and coaching settings. She serves as a psychiatrist for the Colorado Department of Corrections Residential Treatment Facility, specializing in complex diagnostic evaluations. And she's also passionate about medical education, where she's a two-time recipient of the University of Colorado's Teaching Award. Beyond her clinical and academic roles, Dr. Garvey is the founder of The Signature Self, a coaching practice that empowers parents to raise children without fear. She lives in Colorado Springs with her husband and 3 children and finds joy in running, gardening, yoga, traveling, reading, and puzzling. I love puzzling, by the way. Dr. Garvey, welcome to the Quantum Couch, and thank you so much for being here.
Thank you so much. I'm really excited to meet with you today.
So, Dr. Garvey, before we get into the science, I'd love to start with something more personal. How do you experience intuition in your own life or clinical practice? Do you remember a time where your gut feeling proved to be especially important?
Well, I thought about that, and I wish that I had one of those stories for you where, my intuition saved us all. I don't have anything like that, but I can say that intuition is a huge part of my daily work with patients and just in my life in general. It's something that is a skill that I do actively develop, and I think that's been really helpful for me. I can tell you um, the most recent time that was kind of we'll call it saving the day kind of intuition. um, I was asleep in the middle of the night, and I had this feeling like, that feeling when somebody is watching you, like you can feel eyes on you. And I woke up and I looked around and my dog was looking at me. And she sleeps in the bedroom and she's just there next to my bed and she's just staring at me. And all of a sudden, I had this lightning moment where I was like, she's trying to tell me something. Um, the dog is communicating with me and she's telling me that something's wrong. Um, so I got out of bed and sure enough, like our downstairs was flooding. There was water everywhere. And we had, because probably a combination of her intuition and mine, um, we got it turned off and didn't sustain any major flood damage. But if she had not woken me up or whatever it was that she was doing, we would have woken up to just, I mean, it would have been catastrophic.
Oh my goodness. So she didn't have access to downstairs. She was in your room, supposedly sleeping with you, and then she woke up, and then you woke up, and both of you kind of had this intuitive moment you shared.
The door was closed, so she knew. I mean, I know that she knew, and she's a dog, so she has her own set of senses that she was using. And I don't know, maybe she could hear something, um, maybe there was a smell or who knows how she knew, but she, she woke, and I sleep with earplugs. So even if there had been a noise or something, I wouldn't have heard it. So I was very lucky. Yeah.
So how do you explain this? I mean, this is probably one of many examples in your life. I have many examples of intuition being very much on par with the data that I receive. I mean, like I listen to my intuition all the time. It's one of my basic um things that I tune into when I have to make decisions. And I'm a pretty scientific person. So, but that intuition is very, very important. What do you think of that?
So I'm a very scientific person too. And I think that we spend a lot of time trying to separate science and everything else. But my my understanding of science is that it actually encompasses our entire experience. And that if science doesn't have an explanation for something, it's not because there isn't one. It's because we haven't been able to name it or understand it yet. And intuition, I do think that science is catching up a bit. I mean, we are starting to study it. Uh, and what I think about intuition is that it is not magic, it is simply an unconscious processing of a great deal of information in a very short period of time, um, and a form of pattern recognition. So, you know, I teach medical students, and one of the things that we do is we work on training our intuition in the clinical setting. And we train it by kind of forming an initial impression and intuition, and then going back and breaking it down. Like, okay, here was our intuitive response to this situation or this setting or this picture or whatever. Let's go back and break it down and see where we got that. So one of the exercises that we do, and when I'm working with the medical students, we are doing these diagnostic assessments, and they usually last anywhere from, you know, an hour and a half to 2 or more hours. And they're very complex and they're very in depth. And I would say that they're comprehensive. But as you know, when you're evaluating a psychiatric patient, especially a complex one, you cannot ask about every single thing. You have to be uh, considering a working diagnosis throughout and then exploring that as you go based on what you observe and what they tell you. So we try to get our working diagnosis um, very, very early in the meeting. And I want to be able to have something that I'm thinking about from the first sentence that that person says after walking in the door. Um, And so before they even walk in, because our electronic medical record has a picture of everybody, right? So we will sit down and look at the patient's picture. And I ask my student, okay, what do you think's going on? And it's a headshot, like a mugshot. Okay. So, so like, what are we dealing with here? And they just look at me like, "Oh, I don't know. This is the guy, you know? And I'm like, no, that's not just a guy. That is somebody who has a chronic psychotic disorder. Or, this is somebody who has been using meth for 20 years. And they're like, okay, how can you tell? Or we need to screen this person for an intellectual disability right off the bat. So we go through and they're like, where did you get that? um, and so I kind of take them through step by step. I'm like, we have a picture of this person's face. What can we tell about them?
Hmm.
And we really only have one sense when we're looking at a picture. We're using our vision, right? So, let's look at their hair. Let's look at their skin. Let's look at their choice of grooming. Let's look at their tattoos and where they are and what they say. How's their dentition? Is this person's face caved in from not having any teeth for a long time? And these kinds of things. And So, does this person look like they are trying, or how's their grooming? Is there a clear gang affiliation? So we are talking about things that we can intuit from just looking at a photo. Um, and then when they come into the room, I say, okay, in addition to everything that they're reporting and the history that they're telling us, let's continue to use our intuition throughout by observing the other things besides what they are telling us. When this person walked in the room, how did they smell? Has this person failed to shower in the last month, or are they clean? Um, in the prison setting, people don't have access to things like cologne, and yet some people come in smelling awfully fresh. I don't know how they do that. In prison, we don't, there is no access to makeup, um, but people create it out of things like crayons and Kool-Aid and things like that. So you can look at even the grooming and hygiene piece, right? Um, and then I ask my students to check in with their reactions to people is contrary to everything that they've been taught. In medical school, we teach students to ignore your feelings about a patient and just treat the problem. Ignore how you feel about a person. And I think that that is absolutely misguided.
Agreed.
Uh, because if you have strong feelings about a person sitting across from you early on in that meeting, or even by the end of an hour or something, you need to be thinking about whether or not this person has a personality disorder, right?
Mhm.
Our reactions to strangers and people that we are just meeting should be fairly neutral to mild positive, right? Like, I don't know, they seem nice. Um, if you are feeling a strong bond with a person after meeting with them only a short time, that's not normal, right? If you feel intense pity or sympathy or something in a very short period of time, that's coming from them, right? If you feel belittled and small sitting in the room with someone, that's coming from them. Or threatened, or so we check in with our own feelings to help guide our assessment and treatment. And ultimately, when I diagnose a personality disorder, yes, we can go through the DSM and we can go through criterion A through G or whatever, and look at, okay, has this person met criteria for conduct disorder before age 12? And we go through, um, but I don't even start going through that criteria until I've assessed that I have the kind of reaction from our interpersonal engagement that is not typical.
Mhm.
Uh, And so we let intuition guide us throughout the whole process. Um, and the intuition just comes from our brain processing all of these patterns and data. So somebody says um, over and over again if they use certain language, we pay attention to that. And the brain, with repeated exposure, is going to find patterns here. If somebody repeatedly uses possessive pronouns to describe a serious mental illness, I'm going to wonder, why are we so attached to that diagnosis? Well, I need some help with my schizophrenia. My schizophrenia is acting up. Well, I've really found that people with schizophrenia aren't super happy about it and often don't believe they have it. So they are going to come in talking about it like it's mine, and you can't take it away from me.
Mhm.
So we listen, and so those are the kinds of things that train our intuition, because I believe that intuition comes from just a huge amount of information, and the more actively we're paying attention to the information that we're gathering, the better our intuition.
I mean, some of the things that you're talking about is data collection that's very unconscious. Like you're collecting data about pictures, about how they behave, the words they use. what you make also of even subtler data that's being given off. Like, for example, I've had several times, and I do a lot of psychodynamic psychotherapy. So we do a lot of insight. We pay attention to the things that float up from the unconscious, and we um, really kind of look at what is said in between actual words. But I've
Mhm.
had various times where I would look at a picture of someone I didn't even know, and I would say, I have a feeling this person had some sexual abuse when they were young. And that is like very far-fetched. Like one would say, like, where the hell did you get this from? Like, okay, you can maybe get some data that they use math because of various physical features, or that they did a lot of like cocaine because of just how their nose shape is, or their teeth and kind of what kind of drugs they use. But how do you get sexual abuse from a photo is just, that's various steps even further. But that has happened to me several times where I would get like almost a story, like a feel for the person through how they even they're smiling, or their facial expression. And I tend to be relatively correct. Like, this is not the only time that happened. That happens in a lot of other times where I speak to like a patient and they're telling a story, and all of a sudden I get like a flash of like an insert of knowledge about something regarding their life. And then I have to speak about it because it feels relevant. And then they validate often kind of what I say. And it happened many, many times. How do you make sense of that?
Well, I think that again, I think that we are able to process things that are again that we cannot experience in a conscious way. And I have the same thing where I can look at a picture and say, I think that this person is probably has a sex offense in their background. And 90% of the time that's accurate. So is there a look that I can't put a name to
Hmm.
because it's so unconscious? Are there facial features? Are there micro expressions? Is there something in the posture? Um, I don't know. But I believe that we're getting that information from somewhere, and I don't think it's coming from the ether. I think it's a form of pattern recognition, and that we are not giving ourselves enough credit for how much information our brain is looking at every second of every day.
Do you by any chance know which areas of the brain and how the intuition is impacting, or how the brain is impacting intuition? Have you looked into at all the aspects of the
There
brain that do that?
there is some research around that. I don't have details. I know that I started kind of looking into what is the current research and intuition, and you can get down in the muck with that. Like they are looking at PET scans and, trying to figure out what areas of your brain are processing things and finding out that it is a lot more complicated than we can even guess. Um, what Daniel Kahneman wrote a book called Thinking Fast and Slow that talks about this idea of intuition, and that is that, he tried to break it down into two categories of thinking. One being fast thinking, or system one, where this intuitive thing where we have an initial like snap impression that feels like an instant knowing, right? Versus the slower kind of system of thinking, which requires us to actually slow down, pay attention, calculate it out, that kind of thing. Um, and I think that is a good way of categorizing at least two of the ways that we think, but I do think that there are probably quite a bit more, and that we're just at the tip of the iceberg for understanding how the brain works and processing. And that, each of those systems of thinking has risks, benefits, and hopefully you use them together, right? So I don't when I'm seeing a patient, I don't want to end with the same diagnosis that I often do. But, that first chief complaint moment, hopefully I have some time to flesh out and be more thoughtful about my assessment than the first snap judgment I have when I meet them. Often it's completely correct, but you can't rely entirely on it to make good decisions.
I when I used to teach medical students as well, I had them do similar exercises to what you have your students do. And what I usually said is go talk to this patient. And then when you come back, tell me how you felt in the room while you were
Uh-huh.
speaking to the patient. And
Yes,
then
absolutely.
they would tell me however they felt. And then I would ask them, well, what do you think about these feelings? And then I would teach them to not necessarily judge the feelings that they were having in the room, whether they were positive or negative or anything in between, but use those feelings as data to further
Yes.
assess what is happening in the room. So my classic example would be for them, well, if a patient comes in and they start crying, there are
Mhm.
moments when I sometimes would feel so sad and really feel for the patient. But then another
Mhm.
patient would come in and start crying and I would be like, "Shut up. I mean, I wouldn't say this to them. I would think this. I like, "Shut up. I really don't want to hear this. This is so annoying. Please stop crying." And I could judge myself and be like, "My God, you're being so cruel." But a part of me would also look at this data and say, "Why did I react to this patient this way? Was it, like, really because I'm cruel? I don't think so. I consider myself a pretty empathic person. But is there something that's happening in the dynamic of this person and me or this person in general that's making me feel this way?" And so what I would always help my students, like, no matter what field you're gonna choose, you're gonna have feelings about your patients. Pay attention because that's gonna give you data on how to help them further.
Yes, absolutely. I think it is so sad that that isn't taught. Um, to use your emotional response to a patient as additional data. And I have never met a psychiatrist, psychologist, or really anybody that's worked for a long time in the behavioral health field who doesn't do that. Uh, and or at least if they're effective, they will reflect on how did this person make me feel, and boy, isn't that interesting.
Absolutely. I wonder if our intuition gets stronger and better as we age because we do learn and collect more data throughout our years. And so we have a much greater encyclopedia of emotional signs and observations we have made even unconsciously. And so our intuition strengthens because we just have more data to pull from as we get older.
I think that's a really, really astute observation, and I think it's absolutely true. And I've definitely seen that in my clinical practice that I have only gotten better with time, um, at coming to those initial impressions and having them be more accurate. And when they study intuition, they actually find that that is the case. Intuition is not always accurate. That's one of the problems with it is that it can be prone to things like bias and you think you see a pattern, but there isn't one, or you have misjudged the pattern. And, they have shown when they do study intuition that the times when intuition is most likely to be reliable is when you have repeated, consistent exposure to a situation. And medicine is the prime example. Essentially, um, an experienced clinician will see something over and over and over again. And because in medicine we tend to get um, feedback as to whether or not we were right, then you're constantly testing. So, if I remember kind of vividly in residency, going into a patient's room and smelling the smell and just and I'm one of those super smeller people, so like I am, god, that's a weird smell, and then finding out my attending to, oh, that is a characteristic odor of hepatic encephalopathy and liver failure, and oh, okay. And then the next time I smell that smell, looking at the lab, so sure enough, okay, so you're honing that sense and it becomes more accurate over time. So the repeated feedback piece is important.
Hmm. Yeah. Absolutely. So, do you have any examples where your intuition really helped with honing in on a diagnosis? Like, was there anything in particular? I mean, you've mentioned when we were talking outside of this podcast that you specialize in really honing down on a diagnosis for patients. So if there's any questions about what a diagnosis is, you're the person that people come to. Is there an example that you can share that will not reveal an identity of the patient that may have happened? Or maybe rewrite the script if you want to kind of cover up the identity.
Um, it is useful in every interaction um, that I have. I would say in particular because of this, long, like decades long, just repeated experience. I am very, very good at identifying psychopathy. And again, because I get the repeated experience as well as the feedback from objective testing measures done by the psychology team. So when I do my diagnostic assessments, I work with psychologists and they go in and do psychological testing. And then, so we work together and with every patient, we're doing a huge record review, talking with family, do whatever we need to do, right? Um, so psychopathy has been that sort of one thing that I can just put my finger on it and say, yes, that's who I'm sitting with here. And I can do that really early. And it does become a sense that you can hone. And I've had people even that come in feigning psychopathy, and I saw somebody the other day who seemed to be feigning psychopathy. I don't know why. I don't have that figured out, but and he told me some stuff.
Can you define I'm so sorry, Dr. Garvey, can you just define for people who may not know what psychopathy is?
Absolutely, absolutely. So in psychiatry, I don't I don't know exactly the definition um, that like the forensic people would use, but my interpretation of psychopathy is that you have a spectrum of personality disorders called antisocial personality disorder. You may hear it called uh, sociopath, psychopath, that kind of thing. And this is essentially kind of a criminal mindset that belongs to folks that often, have come from like a difficult background, right? Often abuse or neglect in childhood, who and these are people who start having behavioral problems very early on, usually as soon as they enter school. And these are kids who who set fires and hurt other kids and, and essentially um, end up in the prison system. And a huge percentage of the people that we treat do have antisocial personality disorder and sort of engage in illegal activity throughout their lifespan, right? Psychopathy is considered to be kind of a severe subset of antisocial personality disorder that, in my mind, includes an element of enjoying the suffering of other people a little bit. And I see it more of a severity scale. And it is
Mhm.
something that is measurable. There's something called the PCLR, and it's the Hare Psychopathy checklist. And it's a subset of, I want to say, like 40 items. And if you get above a certain score, you meet criteria for psychopathy. And that essentially is the severe antisocial personality disorder.
Mhm.
So I have had people come in and say, well, yeah, so some guy comes in and he talks to me about, yeah, and so I killed a lot of dogs and and I put him in the freezer and all this stuff. And I just was not getting this psychopath vibe from him, right? Whatever that information is that you get from being in the room with someone with psychopathy, he didn't have it, right? And I walked away from the interview and I'm like, well, he said all this stuff. I just don't even think it's true. I think he was lying. And I don't know why he would lie about something like that. But and then I talked to the psychology team and said, what did you guys get? Is there any indication that there's actually psychopathy here? And they're like, no. And we I didn't feel that way in the room with him at all. And so the psychology team met with him and also just said, we didn't get that impression from meeting with him either. So it essentially, he was giving this historical data that would support a diagnosis, but sitting in the room with him, that feeling, that intuition was not there. So I do use that. And with other people, they can come in and appear, polite, pleasant. Um, but as you're sitting with them, you get a feeling that this is somebody who lacks empathy. This is somebody who uses other people. And then we see that and um, start looking deeper into their history. And sure enough, it's all there.
So, how do you differentiate between what is an intuitive hit versus your countertransference? I mean, we're psychiatrists, and not all of us, and definitely not most of people, go to therapy to figure their own stuff out. And
Yes.
one of the things that we definitely learn in psychiatry when I learned about psychodynamic psychotherapy is that I wasn't mandated, but I was incredibly strongly recommended to go to therapy so that I could work my things out. Because when you're in therapy, especially, we learned there is what the patient's bringing in, what I'm bringing in, and then the dynamic that we're creating. And so often we can also react in our way to the patient because the patient may be reminding us of someone in our life that may be very triggering, either positively or negatively. And so for people who have been in therapy or who are very insightful by nature, they can work through that and kind of think through and work through, what am I feeling? Is this my patient's feelings? Is it my feeling? Is it something else going on here? But how does just like an average Joe who's never been to therapy or maybe not as insightful can figure out what is an intuitive hit versus their own reactions to the person for whatever reason?
I think that's also a good question. And something that probably you have to answer independently, in the moment. It may be different for each person, right? But I do think that countertransference, this the feeling the that the patient you're working with evokes in you is more described in a therapy setting and occurring over time, right? Having to do with kind of these gradual feelings that develop within a therapeutic relationship over a long time versus an intuition being like, I just met you 2 minutes ago and I have a feeling about you. Um, so it's probably part of a similar phenomenon, but I think somebody who is aware of their intuition and how that works is also somebody who can look in at their own emotional responses and know where it's coming from. Like, this is a response I'm having to this person as opposed to some person is bringing into the room.
Hmm.
I think that part of intuition, you had mentioned in your introduction, how part of intuition is checking in into kind of your somatic responses and things like that, right? So we have to constantly be looking at our feelings, where they're coming from, what they're about. This is why I think they call intuition a gut reaction, is because some of the science is pointing towards when you have intuition at play, it also evokes chemical changes in the body, right? So it can cause these, physical sensations in the chest or in the gut
Mm.
from release of serotonin and things like that. So you may actually have a true physical response to this intuitive, um, into whatever you've intuited.
Hmm. I guess what I'm wondering about is, and as you're talking, it's coming up strongly, is whether intuition is sometimes global versus very individual. So for example, if someone I meet, I I immediately have a thought like, well, that person is not for me. And or is there something about them I strongly dislike. And I may not be fully conscious at first what I dislike about them. It could potentially be that this person reminded me of someone who I'm not even aware of, and maybe they talk too much, or maybe they talk really fast. And so for
Right.
me, the reaction would be like, oh, no, not for me, because it automatically elicited some sort of like a negative defense. But someone else who may meet this person may be like, oh, this is a really great, funny person who talks a lot, but I really don't mind it. And of course, this is all unconscious for them, and they may really like this person. But
Mhm.
what you're talking about, like when you meet someone who's like a sociopath or who has like a personality disorder, they bring into the room with almost anybody, or if not anybody, the same type of feeling. Whereas sometimes we have individual intuitive hits, but they are more related to us and our perception of the world versus how this person is, like objectively for everybody.
Absolutely. So, to define a personality disorder, you have to have problems in kind of all of your relationships. You have to bring a problematic way of interacting into all the relationships in your work life, your home life, etc. That doesn't mean you can't have any relationships. It just means that they're probably not very healthy, right? But then there are also like individual, like I can meet somebody and they're perfectly nice and fine, but they're not, like you said, they're not for me, or I just don't think that that person I click, you know. And that is another form of intuition too. And sometimes you click with someone and sometimes you don't, and that's okay.
Which is often actually something I speak to a lot of my patients about, is that not every wonderful person can be your wonderful friend or
And be
lover.
your
Like it's
wonderful
just
person. Yeah.
not
And
not everyone is gonna click.
yeah, somebody can have everything right with them and still not be right for you.
Exactly.
And sometimes somebody else can have a lot wrong with them and also be the right one for you. And so that's
Hmm,
a kind of self-knowledge as well.
that's very wise. Yeah, there definitely been times when I was younger and I was dating where I would see someone or I would meet someone and they just were so perfect on paper and really nice people altogether, but just something was missing and I couldn't bring myself to be with this person, even though I really wanted to, but just couldn't. And I had to listen to that intuition. I couldn't overcome it.
Yeah, and I think that we do ourselves a huge disservice when we ignore that kind of intuition, right?
Yeah. Have you learned from that, from not listening to your intuition before? Has that happened to you?
Hmm. Probably, yeah. I mean, there nothing coming very strongly to mind because I think I've always been somebody who does listen to my intuition. I'll tell you one kind of humorous story, but I grew up on, we'll call it a farm or a ranch or something like that. It was just my parents had a 5-acre property and we had a million animals, right? Horses, dogs, cats, cow, goat, sheep, chickens, like you name it, we had it, right? I've raised tropical birds and abandoned baby possums and rabbits and homing pigeons. The list is like bizarrely long. Okay. Um, so because of that, just like huge exposure to animals my whole life, I speak animal. You know what I mean? Like, and again, I'm not saying that I read animal minds or anything like that, but if you spend a lot of time with animals, you know that each species has its own body language and way of communicating, and so I kind of know what's up when I see an animal. I know if a dog is being aggressive or playful, even if it's barking. Like some people, a dog barks and you're like, oh my god, it's gonna kill me. And I can differentiate, like, no, that's a dog saying hi, let's play, versus I'm gonna rip your throat out or whatever. Um, so I can read, I guess, animal body language as well as I can read human body language or similar. I mean, probably not as well, but probably better than other people, right? So um, when my husband and I were first together, we were in medical school together, and we decided that we needed a pet, and so we went to go pick out a kitten because a cat is a good med school um, pet. They're independent. So we go and this lady has all these different kittens and my husband, picks this one up. This is the one. And he's this cute little gray kitten. Um And this is the one. I'm in love with him. We have to bring him home. And I just looked at him like, no, that's a bad cat. And my husband didn't he didn't know, or maybe he had not yet learned to sort of trust my intuition about animals. I He does now. Gosh, I hope he does now. But anyway, so he's like, no, well, this is the one. Look how cute he is. We have to get this cat. And I'm like, well, I want a cat. So anyway, we bring the cat home. So we ignore my intuition, and he was a bad cat. Um, he was, aggressive, and he liked to pee on the carpet right in front of the door. And I mean, you name it. Like, we ended up having to get him a friend just to help calm him down so that he would stop biting us and stuff like that. And if you ask me, in that moment, how did I know this was a bad cat? I have no idea, right? It was just a feeling that I had. And I, you know, should have trusted it, and I didn't. And he ended up just being kind of a nightmare. But I'm in a Facebook group with vets and physicians, and there was a conversation in there recently about cat coat color. And it turns out that there have actually been studies on this, and all gray cats tend to be the spiciest or most aggressive cats, or most likely to have behavioral problems.
Interesting.
Did I know that subconsciously? That had I encountered other gray cats and know that that, because if you know cats at all, you know that you don't just go up and pet a calico. You have to check in with their owner and make sure they're cool with it, or let the cat approach you, because calico cats are really, really feisty. And, if you come and pet them and they don't know you, they'll probably just bite you. So, um, that's something that kind of any cat person can kind of know. So, yeah, so apparently this was studied, and maybe I sort of knew that gray cats are devils. I don't know. Um,
Interesting. Or maybe there was something about with pheromones or some kind of unseen chemical
yeah,
exchange or who
absolutely,
knows? That's so
absolutely, and
interesting.
and and when I got my dog, again, this time I was like, nope, I picked the dog, right? Nobody else gets a say. There's all these cute puppies. I walk over, I get this dog, I'm like, nope, this is the one. Everyone's like, well, okay, if you say so, and she has been just she's my favorite. She's really a great dog. And so it must have been a body language thing or something like that I picked up on. But um,
So with this dog that you got, I mean, obviously you have a very strong connection with this dog. Do other members in your family also have a strong connection, or did you just choose your sole dog and that was just your dog?
maybe, well, yes and no. I think everybody who meets her thinks that she's super sweet. My husband thinks that she is too clingy. She's kind of a Velcro dog. So he's just leave me alone, So it may not be his um, ideal dog, but she's just so sweet, and she's sweet with kids and people. And, so I think that nobody would argue that she has a bad temperament. So she definitely has a
What kind of a
that.
dog is she?
She's a golden doodle.
Mm.
Um, Yeah, I think there's something to be said there for just, and again, body language. When you're passing someone on the street, when we're talking to somebody, people are making all kinds of uh people are communicating with us in all kinds of ways with their body alone. I read a book called I want to say what every body is saying. Um and I th Joe Navarro maybe wrote it. I hope that's right. Um, and he was an FBI, um, person who studies, body language and what kind of information that we can get from how somebody sits or uses their hands, or whether they lean in or lean out. And in psychiatry training, we learn a little bit about that, right? They teach you about making eye contact and leaning in and appearing interested, and paying attention to your facial expressions and things like that, so that we are remaining neutral in the room with somebody. But the reverse of that being that we are getting information from people constantly. Like, we can be sitting there across from each other, and I can know without you telling me that you are bored or distracted or really engaged and interested in what I have to say, or if you hate me, like, people know that without any words having to be exchanged. And if you think about this idea of building pattern recognition over time, you can tell what your spouse is thinking better than anybody else in the room, because you have that much more exposure to them. So when my husband is in a bad mood, I know from the other end of the house, not because he's
Hmm.
saying or doing anything, but because I get his vibe. I'm like, oh, he's grumpy today. So, um, or, so you have this sort of shared consciousness, um, just by repeat exposure and knowing people's, um, facial expressions and whatnot. And the same way that, like, you can get we were out to dinner last night, for my daughter's birthday, and, y it was the 5 of us, and then she brought a friend. Somebody said something in the middle of dinner, and the 5 of us were just dying laughing, right? And the friend was kinda laughing too, but just, because she is not probably privy to what everybody's thinking through body language and whatnot, was not tickled in the exact same way. So, yeah, so I do think that facial expressions and whatnot just give us so much. And if you pass somebody on the street and the eye contact and smiling, and you just, you're going to have a different response to that versus somebody who appears to be tense or scowling or something like that. And those are kind of macro expressions that we can get really easily. But then, there are all these people who study micro expressions too, and I find those kind of challenging myself.
Hmm.
Um, but I do think we can probably process them subconsciously.
So you're obviously very intuitive. You use your intuition all the time in various settings, work and personal life. It sounds like this is something that came and still comes naturally to you. So, what is your take about intuition? Is it something that we're born with? Are we naturally predisposed? Can we develop it? What about people who have difficult time with intuition? What are your thoughts about all of that?
Um, I think that we all have it. We should all have it, because if it is fast processing, then it's something that every brain is capable of doing, right? Um, we can develop it by repeated exposure and testing. Um, some people, I think, are naturally more intuitive or more able to listen to their intuition, perhaps. My daughter was telling me, she's in high school. She said, I have a friend who has amazing intuition and she ignores it every time." I said, "Okay." So maybe that's something that we learn as we get older, is to actually, like, yeah, let's start trusting and relying on our intuition, right? Um, but yeah, I'm sure that everybody has varying levels of intuition, but I think that the more that we pay attention to it, develop it, and listen to it, the more we can be successful with that.
I do wonder if there is a connection between reading faces, being able to explore nuances and interactions and intuition, because for people who may have some neurodivergence, so for people on the spectrum who have a hard time with reading the room or reading facial cues, I wonder if they also have a hard time with their intuition, whether they even know what it is, or even partially just have a difficult time with listening to themselves because they have a difficult time with reading cues. Did you notice that at all in your practice or in just life? Because I think I'm noticing that in mine.
That's a I think the answer to that, I don't know that I have the expertise to answer that, and it's also a very nuanced question because I think, um, I have read a couple things recently that, people with neurodivergence actually are better at the pattern recognition piece,
Hmm.
um, and maybe so I suspect that, like, so people with, like, ADHD, I'll raise my hand, I'm one of them, I think are really good at kind of, like, gathering and processing a ton of information really fast
Mhm.
and in a
Mhm.
intuitive, and that is an area of giftedness for people with ADHD. Uh, and I think that people on the autism spectrum have a similar kind of neurodivergence that can lead to that really, really, really impressive sort of synthesis and processing of the information they're receiving, um, while being a little bit blind to other bits of information, like
Hmm.
reading faces and feeling the emotional tone of a room or something like that, right? Um, so I kind of think of it as, so we know that we all have our five senses, and maybe there's more that we haven't named yet, right? We may sense things that we don't have a name for yet, right? Some people have better vision than other people. Some people have better hearing than other people. Again, I'm one of those people that is a super smeller. I can, so I can smell something and get more information from that than everyone else in the room. Um, and therefore come away with a different um, amount of information, maybe.
Mhm. Mhm.
And so I do think that, so people with neurodivergence may have a greater ability in one area of intuition and less ability in another.
I love that
And
answer. That's a very nuanced and great answer because what you're saying is that it does depend on the person. It depends on where their strengths and weaknesses are, and we all have those strengths and weaknesses. And as you said, especially with neurodivergence, there is a also giftedness aspect that can correlate with if they have ADHD or autism spectrum and what are they gifted in, and the data collection and how they're able to utilize that giftedness. I think you gave a really, really good answer. Yeah, that makes sense. So, are we ready for a lightning round?
as ready as we'll ever be.
And question number one. What's your favorite way to quiet your mind so you can tune in your intuition?
Ooh, that's a good question. There are a few different things that I like to do. I do find that yoga is a really good way for me to quiet my mind because it can, you keeps your body moving, but in a way that kind of allows you to slow down and stop thinking about the outside world. And so that's a very guided way to kind of tune in.
Mm,
Um, for me, if I, because of the ADHD and I'm just always thinking about everything at once, um, sometimes I just have to let things marinate, honestly. And so I like to garden. So I'll go outside and just fiddle around and snip some things and poke in water. And eventually, whatever I need to access will sort of surface. So I think when I'm kind of doing something else, it lets me access the other part of my brain. I think that's
mhm,
why I like things like doing puzzles, because if my body is moving and active, somehow I feel like that sort of shifts some of my energy into a physical energy while my mind focuses.
mhm.
So I'm one of those people that, like, if I'm at a medical conference or something, I have my knitting bag with me. I got to keep my hands busy, otherwise I can't really pay attention to the lecture. So that's kind of how I quiet my mind, is by keeping the rest of myself doing something.
Mhm. Yeah. I think a lot of people with ADHD tend to do similar things. They doodle or they do things to kind of keep themselves going so their mind can rest. Like they're like or go on runs. A lot of people like to go on runs. Yeah.
Definitely. it's hard for me to pay attention to one thing if my hands are not occupied.
Hmm.
So I always have something in my hand that I'm messing with, right?
Question number 2. Most recent book that you read and loved.
All the Colors of the Dark, really fun.
What is it about?
Oh, well, essentially about a kid who is kidnapped and is held captive with somebody, and he spends the rest of his life trying to find her.
Gosh.
Mhm.
Is the ending good?
Wonderful. Really good book.
Question number 3. If your intuition could give you one word message right now, what would it say?
Uh, I don't know. That's a tough one. I think at this point in my life, I have too many things going on, and I need to like simplify a little bit. Too many balls in
Hmm.
the air.
Question number 4, and the last one. What genre of music helps you tune into your intuition? If there is a genre of music that you, particular one that you think you really love for that.
I love to listen to classical music when I need to be with my thoughts.
Any
So
particular composer that you love?
no, I play piano and I make a list for myself of just beautiful pieces, and it's for whatever reason that lets me just kind of tune in and be a little bit more in the moment.
Well, thank you so much, Dr. Garvey. Um, is there a way that our listeners and viewers can get in touch with you? You're a coach, so can you tell us a little bit of how people can find out more about you and access also your coaching services?
Absolutely, yeah. They can email me, Katrina at thesignatureself.com, or my website, thesignatureself.com. I love bringing intuition into my coaching. I think, um, boy, that's almost the whole reason I went into coaching, is because my brain is incredibly good at recognizing problems and coming up with solutions in a very intuitive way. And psychiatry and therapy don't have as much space for that as I would like, because
Hmm.
I find it very gratifying to immediately recognize the problem, find a solution, and work with somebody on finding that day. And in therapy, that's a years long process. And so coaching fills that need for me to be able to really utilize my problem solving skills with people.
That's wonderful. I wish you best of luck with your journey with coaching. I actually am learning more and more about coaching, and I find it so interesting when psychiatrists can kind of compartmentalize their therapy and then they also do coaching, and how these two things can kind of be under one umbrella for a person and to be able to do both. So a lot of respect to you, and it's very inspiring. Well, Dr. Garvey, thank you so much for being on Quantum Couch. It's been a pleasure speaking with you, and thank you for bringing your intuition into the space. And best wishes to you.
Thank you so much. I really appreciate it. It was nice to meet you.
Thank you for tuning in and listening. If you enjoyed this episode, please subscribe, leave a review, and share the Quantum Couch with someone you think might love the space too. If you would like to reach out, you can email me at thequantumcouch@gmail.com. You can also follow me on Instagram and Facebook. Just search for The Quantum Couch. Thank you for listening. Until next time, I'm Dr. Ina Conboy. Take good care, stay curious, and keep exploring. The information in this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Listening to this podcast does not create a physician-patient relationship with Dr. Ina Conboy or any guest on this podcast. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.